I don't agree, no, I agree, but like, if with the assumption that there are village treatments present. And the assumption.
You're all set.
maybe they're using it throughout the surveys are being had. I mean, no, I mean.
I have a question for you about my name.
I mean, you could say that people lie, I mean, that's not source of what kind of sanitation facility they usually, but it's not. I mean, not because it's nominal,
When I went to, yeah, but when I
That
was.
was the other thing, I put it segregated, I consider it to count for it.
Were you with us? Gates. took us through the meetings that-
Yeah, wait, I went to Roger, the big, machine.
No, not the big machine thing, but I went to the rural.
No, I don't think I was in that one. Yeah, I heard you spent like 2 days on the bus.
And they would have counted as safely managed if it was a. If it was a survey.
Yeah.
But like, if you really look into it, you open it, you do that.
But you must, I like how people being exposed to pathogens.
For sure, because when you start crawling out,
Uh-huh.
you know, I mean, like maggots are crawling out, they were, you know, it looks neat from, and they probably cleaned up the day.
Yeah.
But yeah, like looking at some of those toilets, they were not. I mean, but you don't.
Yeah, okay.
No, well, not being used after being filled. So,
Right.
yeah, you wouldn't want to use it.
Well, when they're full.
They're not full.
Well, they're not. Okay.
They're not full.
They're just two, they're unused.
They're unused.
Yeah, okay. Okay.
Well, it's there. It looks like, you know, they cleaned the surface. But you were there, weren't you?
But is this,
When we went to Senegal.
Yeah.
And we saw that.
we're not.
Really sick. Some of them are, they're not full, but. But when you ask them, they said.
Yeah. Well, there was some of them does.
I remember we went around, some of the people that were not part of the community, they were like saying, oh, yeah.
No, there's a different question.
Right.
It's not like it's surveys, they have a lot of invoices.
Fair enough.
If you're worried about positive bias.
Fair enough. Fair enough.
Wait,
No, I'm just saying, like in my stuff. When we have. Anyway. Oh, yeah. Even. So.
Yes, my take is that you really need to look at. No. The big stuff, don't, but whether it's safe to take, it's not rocket science.
Yeah, no, and that's when we had an opportunity to actually open them up. Go with them.
Yeah.
Turn out the system and choice that.
Nine times out of 10, probably that's only external. For sure. Yes.
Good afternoon, everybody. I hope everybody had a nice lunch. Everybody had a nice lunch?
Yeah.
Awesome, fantastic. I'm actually up here. We funded this piece of work a couple of years back.
We being UNICEF.
We being UNICEF, so I'm up here. It's UNICEF and with the Sanitation Learning Hub. Actually, it was supposed to be Jamie, my counterpart at the Sanitation Learning Hub, that's supposed to be up here today, but he's in another session. So, these guidelines were actually born out of a lot of several collaborations between different actors, including WaterAid, Plan International, and the idea was, you know, we're all kind of measuring things a little bit differently, and we're learning a whole bunch of things from our different experiences. Could we try to capture some of those best practices, put it into one document, and so that we can have at least some alignment and agree on what we should really be measuring, right? And fortunately, you know, somehow we were able to, after I don't know how many consultations, Andy, you had to do with like 30 or so people, we were finally able to kind of put together this document. And one of the things that we're looking at now is like, you know, how do we get people to actually, the rest of the people that were not involved in making it, to actually look at it and use it. So we're lucky today because we'll have Andy, who's actually, this was authored by Andy, and he's going to be helping introduce the document and also how it was put together and all those details. But we also have an opportunity to listen to Rick, who's from the JMP, and also someone from our colleague from Uganda USAID, Patricia, who's going to be explaining some of the country experiences that they've had with similar types of work. So I think I'll stop there with regards to introduction and hand over to Andy. Yeah.
Great, thank you, Mike. So, as Mike explained, we're going to start by looking at a couple of documents. I'm sorry if you feel we've kind of lured you here under false pretensions, talking about national M&E systems, but we will get to national M&E systems shortly. But so, as Mike said, these were put together through a series of consultations, supposedly sort of looking at large-scale programs, looking at some national systems, looking at what we thought was best practice, and trying to come up with a framework, which more specifically is a sort of framework with indicator tables, saying these are suggested indicators under each component area of the framework that we felt a good M&E system for a kind of area-wide, large-scale rural sanitation and hygiene program, or sub-national program should be doing, which came out of reviews of evaluations and previous monitoring, but we found there was always some elements missing. I'll skip in, why did we do all this? Obviously, we're looking to have more progressive M&E, looking not just at indicators, looking at approaches, looking at how you collect and use this data. As I just said, we're pulling from large-scale programs, trying to take tried and tested indicators. But we were always thinking about how can we encourage national M&E systems to adopt some of this more progressive monitoring, knowing all the restrictions and constraints they face. how can we move them towards sort of more progressive, more comprehensive monitoring. I'll talk a bit later in this about some of the problems that we have found. The guidelines here talk about, give some case studies, particularly some from West Africa, which we were hoping to have someone from UNICEF West Africa here. Unfortunately, they couldn't travel. Rick's kindly agreed to fill in, having just done a workshop in West Africa and supported some of the safely managed on-site sanitation monitoring work. So I'm going to go quickly run through the content. Going to present a couple of examples of program and national M&E systems, and then at the end of the session we've got some group work where we're hoping to hear from you. What are your experiences of this type of monitoring? Do we have any sort of positive examples of how we can address some of these challenges and strengthen M&E systems? And what else would you like to see in this sort of guidance? So we kind of tried to target 5 main areas in these documents. So we're trying to look at area-wide monitoring, saying what is different if you've got to monitor every village and every household in a whole district, province, whatever your unit is, working towards national monitoring. We were looking at equity and inclusion, saying that we all talk about it, but we're actually not very good at monitoring equity and inclusion through our large-scale systems. We do research, we do targeted monitoring, but we rarely have systems that are really designed to do this routinely. So trying to look at processes by which you identify people from marginalized groups, what sort of tools are needed, how do you disaggregate, what other things should you be looking at, like satisfaction and empowerment, to really get to equity and inclusion. Safely managed sanitation, we've all heard about the UNICEF's game plan. Obviously, lots of countries are now trying to figure out how they monitor safely managed sanitation, which again, Rick will talk to a bit later. And here we were even thinking, beyond what the JMP's doing at the moment and saying, okay, longer term, what can we do about looking at pathogen flows, looking at areas that are not currently monitored that maybe should be on our radar. Although I should note that we don't have anything on that because there weren't any good examples of there's no tried and tested large-scale monitoring of pathogen flows. Looking at behaviors, particularly around hand hygiene, what can we do for that? And touching on systems M&E, looking at system strengthening. Here we didn't include a lot, but we tried to just point you towards what we thought there's a lot of good work that other organizations have already done. So we didn't try and duplicate that. Okay, I was trying to argue that it's worth spending some money on this. During this process, some people have said, we shouldn't be spending all this money on M&E. It's, we should be helping people, we should be building stuff. Why are you trying to divert money to this? What we have seen is that there is a good return on a strengthened M&E system. If you really know what's going on, if you have you're tracking progress and effectiveness through the life of a program, and you have sort of adaptive management, feedback loops, your impact on overall effectiveness can be really significant. So spending a few extra % of your budget to improve the M&E can have a big impact on the overall results. And some of the sort of payment by results programs, show that very strongly. Okay, I'm going to skip through. How should it all be used? We're hoping, that people will introduce some new indicators. The sort of bottom level is just, we're not monitoring that, or the indicator we're using at the moment is not quite as reliable or useful as that one. There's areas we're not monitoring at all. We're hoping people will review their M&E frameworks at organization, program, national level and say, what's missing from our framework at the moment? What should we include? And in terms of how you monitor approaches used, try and encourage some of the best practices that we've reported. So this is things like having much more systematic checks to look at data reliability, data quality, having independent verification systems, trying to be more systematic at how we go back and check whether those data really are telling us what is on the ground, using mobile monitoring, familiar stuff. When we did the last set of consultations, we're reviewing the final version. Lots of people said we see this kind of more as a reference guide than anything else, that it's a sort of compendium of indicators that you can go through and find things you want to use. So different people are using it in different ways, but we're still hoping that it can have an impact on overall M&E frameworks. So it's set out, it's a bit heavy on the sanitation and hygiene side, just because that's what's out there, that's what we could find to include. We have quite a lot on equity inclusion, less on sustainability, less on process monitoring. We tried to sort of use the JMP ladder to separate out the different indicators. And we've talked a little bit about cost tracking, impact evaluation, again, pointing you towards other resources rather than trying to do any original work. Very much driven by what was available. You know, we put this all together in a fairly short period of time, so we didn't do a lot of original research. We were just trying to pull together what other people have already done. I give a couple of examples. Safely managed sanitation services. We provide some indicators. We provide specific examples. So we have 7 questions from the core and expanded household survey questions used by the JMP or promoted by the JMP. SNV, through their Sustainable Sanitation Hygiene for All program, had a very detailed monitoring of safely managed sanitation in rural areas with 29 different questions that we include. IDE Cambodia put together an FSM survey that was done through the technical working group in Cambodia. So all the stakeholders in Cambodia contributed to that. So there's some sort of nice monitoring tools that have been developed that we included in there. So I give another example, obviously far too small for you to read, just saying this is the 29 SNV questions. On the right there, I'm trying to say, you know, they're looking at use, functioning, where the feces go, looking at containment, whether there's safe containment, whether there's outflows, whether solid waste added to the pit, emptying and sort of offsite services, use of facilities. So one of the key things for me here is we're really starting to look much more closely at safe containment, and which requires observation, requires a slightly different way of monitoring. In some of the other areas, I just picked out 3 or 4 examples. One of the things we liked, RICE, the Institute for Compassionate Economics in India, have a nice question on measuring open defecation, which they tested and found gave 20% higher reports of open defecation. It's doing 2 things. One, it's looking at sort of desirability bias and saying some people defecate in the open, some people use toilets, what do you do? But it's also asking individually within the household. So it's asking every member of the household rather than a sort of aggregate household response. There's some examples of how to measure child excreta disposal. Obviously, difficult to monitor because you're not asking, often I'm not asking the person who's practicing it. Hand washing, I'm skipping through this very quickly. We can share the presentation if you want to see the detail. On hand washing, we found a nice example that UNICEF Indonesia had developed using a composite indicator that looks at self-reported hand washing practice. It looks at mention of critical times for hand washing, looks at the observed presence of the hand washing facility, whether water and soap are at that designated place, and actually asked the household to demonstrate how they would wash their hands and then observe whether they used the water and soap and what they did. And through all of those elements, they were able to get a much better take on whether that household actually washes their hands with soap and when they wash their hands with soap and water. I'm skipping very quickly. Equity and inclusion. So there's a whole series of different tools there. I think 12 different examples of data collection tools on equity and inclusion, including some gender-specific tools. But one of the key things here is saying it's not just about disaggregation of your results, it's actually having a process whereby you identify who are the main people from marginalized groups, which usually differs by context, so you can't just generalize across a country or a program, looking at the barriers to the use of services, and then looking at all these different aspects: satisfaction, participation, empowerment, and so on. And actually, are there systems to encourage all of this? So the guidelines very quickly talk about what should be monitored, what tools and processes should be used. Talk a little bit about sampling. I've already mentioned like verification checks, saying, you know, ideally you need layers of data quality, data reliability checks. So some internal checks, some external independent checks, some user verification checks, you know, going back to the users to see if they agree with the data that you found, looking at who undertakes M&E and how that affects the results you get, and designing the system for use and learning. And finally getting to a national M&E system, which is why I was skipping through all that. Here's just a few of the examples we picked out. Again, I'm not going to say too much about these. Mauritania developed, was a partnership with UNICEF and ARCVO in West Africa, supported by the Dutch government, where I think they supported 5 or 6 countries to develop national MIS systems for sanitation and hygiene. Mauritania was one of those. Where they had funding problems, the project supported development. When the project finished, the national government didn't have the funding to continue the support of the ACVO system. All the data got locked into the ACVO system and the government couldn't actually access its own data. And eventually they reached a compromise where they're developing a new system, and they will be able to transfer the data out of this locked system into their new, very simple kind of Excel-based system. So a kind of negative story there, but saying, you know, this stuff is difficult. You've got to think about all of the financing and all those other things when setting these things up. That was only trying to measure ODF toilets and hand washing, so very sort of basic. Mali system, again, is a paper-based system that gets uploaded by government officials to Excel spreadsheets that then gets uploaded to an MIS. They've piloted data to be uploaded from mobile phones, but as far as I know, that's still not operational. Again, they're struggling with finance and how do they actually sustain the financing of this system. But it's more interesting in that they look at child excreta disposal, they look at equity. So it's you know, it's a good system in that there is a lot of interesting data in there, but it's very difficult to get that data up through the system. It's a long and slow process. Run out of time. Yes. Okay. Cambodia, another system. They tried mobile monitoring, didn't work. Excel-based system now. Again, core indicators. Struggling to expand it to anything more progressive. Nigeria Wash Norms Survey is an annual household survey, so they've taken a very different approach where they decided it was too hard to get data through the routine monitoring system. They'd run a survey every year. It was initially supported by UNICEF, but the government agreed to finance the last survey. I'm not actually sure whether that's correct in the end, whether they did finance this. PC, do you know? They did finance it. Okay, we'll skip past that question. They were going to finance it, which is why I asked, because I was wondering what actually happened. But again, that survey is really interesting. They look at other hygiene outcomes. They look at safe management and sanitation services. They look at equity. So there's a lot of good data in there, but it's an expensive process. Finally, Kenya, only because I've been working there recently. So in 2015, they had a national system, but it was very focused on ODF. It was a nice MIS. Everyone could access the data across the whole country, but it had very limited data and it was paper-based that got uploaded to this online system. This year, they're just about to launch a new protocol, and the MIS is being updated to bring in mobile monitoring and add a whole bunch of new indicators. So they're looking at sort of durable toilets, safe containment, other hygiene, equity, and a whole bunch of other environmental health indicators. So it's ambitious, but it's kind of under development at the moment and being tested and looking fairly promising. At the bottom there, challenges, finance challenges. To add these new indicators is not easy when you have thousands of people going around the country collecting this data. So you really got to think about what are the benefits of bringing in these indicators. Final point here before we pass on to Rick is we are very, when I say we, I mean the Sanitation Learning Hub, Jamie Myers and his team, very interested in anyone who wants to test this framework and guidelines. We put a sign-up sheet here, but anyone who is doing something in this area is interested in getting support from the Sanitation Learning Hub or exchanging learning, getting involved in workshops, talking about this stuff. We'd be really keen to hear from you and talk to you. Thank you. Thank you. Well, do we want to have questions? We've got time.
I think let's just do all three.
Yeah, let's do all three because I think I've overrun. Yeah.
Okay. So hi, everyone, I'm Rick Johnston from WHO. I lead the WHO side of the WHO UNICEF Joint Monitoring Program for water supply, sanitation, and hygiene. And I wanted to share some findings from a recent project we've been working on safely managed on-site sanitation systems. And this is some work we've been doing for the past couple of years with support from the Bill and Melinda Gates Foundation. And we started it out because really looking at the SEG landscape for 6162, target 6162, we found that on-site sanitation was one of the big data gaps where countries rich and poor, just didn't have data about what happens when people are using on-site systems, whether they're fixed latrines or septic tanks or something else. Just they kind of have slipped between the cracks for data collection systems. And because they might be emptied, waste might be transported to the treatment plants where they might receive treatment, there's a whole bunch of stages where one would like to have some data to find out if that whole sanitation chain is really having integrity and the waste should be counted as safely managed. So we've now had a couple of years working with 6 phase 1 pilot countries: Bangladesh, Indonesia, Ecuador, Kenya, Serbia, and Zambia. Good geographic and kind of socioeconomic spread there, and have drafted a guidance document that shows the learnings and emerging approaches to SMOS. I'll share some of those today. And now we're moving toward the second phase, and we'll be working in another set of pilot countries soon. So the objective was that we wanted to work with countries to develop tools to figure out, what are the challenges, what are the possible existing data systems that could be modified or maybe already have some data that would track the safe management of excreta along that sanitation chain. And we've got this draft document here you can see on our website, the safely managed on-site sanitation page on our website. And we want to give some guidance also about the clarifications about the way the JMP takes national data to produce the SDG estimates and how that links with national monitoring systems. So just a quick summary, kind of shit flow diagram kind of thing here. If we look at on-site sanitation, to get to be safely managed, there are a couple different pathways in, and there are many pathways out. So pathways out, pathway out number 1 is just not using improved sanitation or using open defecation. That's definitely not safely managed. But you could have a septic tank or a pit latrine or something that's improved, but that it doesn't really effectively contain waste. And maybe there's a pipe out the back that discharges effluent into an open drain. We would call that improved, but not contained, not safely managed. It would fall under basic sanitation services. Similarly, if it's contained, if it's never emptied, that goes all the way to safely disposed of in situ. If it's emptied and it's then disposed of in situ, often you'll see emptying where a hole is dug nearby and the wastes are dumped into that and buried. That also counts as safe disposal in situ. Or it could be transported off-site for some centralized or semi-centralized treatments. And then we get this other pathway to get counted as safely managed. But there are more pathways out of safe management than there are getting through. So indicators. One experience we had with these 6 countries was that there are different indicators at the national level and the global level, and that's okay. So all countries have signed up to the SDGs, and that includes monitoring the SDGs using the global indicators, which are agreed not by WHO and UNICEF, but by the member states through the interagency and expert group, which is a bunch of UN member states, countries. But it's okay to have national indicators that complement, that go beyond those small set of SDG indicators. And we found a lot of confusion there. Like, we want to make our own national definition of safely managed services that has different methods or terms or definitions than the global ones. That's not great. It's great to have additional national indicators that go beyond and complement and supplement the global indicators, but it gets confusing if you call them safely managed sanitation at the same time. So a lot of guidance around just understanding this relationship between the small number of global indicators and the much larger and granular and nuanced indicators that are important for the national policies and priorities, which will be different from one country to another. So we call those core indicators, which is the small set of indicators that are necessary to populate the global indicators, and then expanded ones, which might be more relevant at the local and national level. So the indicators themselves might be different, and also the scale of data collection might be different, because to get a national picture for SDG reporting, you don't need to measure every household. You just need to have like a representative picture. Whereas if you want to inform national policies and allocate resources to different districts or different towns, you need really a high resolution data. So there are implications on data collection. So in the resources, we talk about this short list. An example might be, has that thing ever been emptied? Whereas countries are very interested in, well, how was it emptied? Was PPE used? How frequently was it emptied? How big was the thing? And should it have been emptied before that? All really good questions, not needed for the SDGs. Really good for national indicators and targets. So yeah, core indicators. The core indicators, by the way, they never use the word safe. We cheat a little bit. We talk about safely managed, but we don't say like it was safely emptied or the wastes were safely treated, because that implies kind of a normative level that the data just aren't available for. Whereas at the national level, if you want to measure safe emptying and you define it and you collect data on it, that's great. So that's a very country specific, country context specific approach. We also looked at the different types of data sources and along the different steps of the chain. And basically, there are some things you can get from households, either by asking representatives in the households themselves, or by going to the household and making a technical inspection. And that's really good for, well, access, what kind of facilities are people using, and containment, because containment is best assessed at the level of the facility itself. So we had some nice examples of sanitation inspections done at the household level, as well as asking households some things. There are examples of how you could try to get at containment by asking households. You can also ask households about emptying, but you can also get data on emptying from service providers, local governments, and administrative and secondary data. For instance, like a regulator would be nice. And as you move to the right on this sanitation chain, increasingly it's those sector sources of data that should be the main sources, because I mean, what does the household know about what happened once the waste left the household? Did it reach a treatment plant where it received effective treatment? You can't ask that of a household. You have to ask that of the sector. So some quick examples of the emerging recommendations that have come out since the 2018 core questions document that I think people are familiar with around containment. I mean, we found that a lot of these on-site systems just are not effectively containing the waste. And especially if it's a wet sanitation system, because you put stuff in, it comes out, and it often comes out through an overflow pipe that goes to the surface environment. And if you can just measure that, you know that's not contained, that's not safely managed. And you don't have to worry about the emptying and the fecal sludge treatment because it's already not safely managed. Yeah, so questions like this, does it have an outlet pipe? Where does that go to? That's a really simple thing that you can put in an inspection or even in a household survey and get some data on containment. Also data from households, you know, have you observed any releases to the surface environment? And you could word this different ways. One of the countries listed some particular events like flooding or some breakage. You know, if any of those result in excreta being released to the environment, would not count as safely managed or contained. And then you could certainly ask households questions about emptying, and maybe where was it emptied to? But here, about the most you can get is it was buried on site or it was taken away. And once it's taken away, who knows? The household doesn't know what happened to it. WHO has been working on sanitation inspections, which are analogous to sanitary inspections for water supplies. They're based on risk assessment, where you identify all the things that could go wrong, and you have a checklist thing, and you say, well, is the platform broken? Well, that's a water one, sorry. But is there like effluent pipe that's discharging from the environment? There are questions that an inspector could do. And in many of these countries, there are existing institutions of things like public health inspectors who go around and look at restaurants or transport hubs or households and have a mandate to check on sanitary conditions. So for instance, in Serbia, it's the Public Health Institute that did these sanitation inspections. And there are digital formats as well with M-Water, which is free. But the third source of data that was really interesting is coming from routine data collected administratively through service providers or organizations that oversee service providers. And some of the kinds of questions that have been recommended here are, well, what's the extent of coverage of emptying services? That's a reasonable thing for a regulator or a municipality or someone to know. There are questions you can ask of, you know, local authorities or the service providers themselves. You know, there are difficulties here because there are informal service providers, there are illegal practices, so it can be hard to get data. But at least, you know, we found examples. There's a lot of reported discharge to, say, landfills or sewer lines, which is not, you know, the best practice, but it's probably better than discharging it into the river. So there, you can get useful information by working with service providers. And likewise, treatment plants. There shouldn't be 2 question marks there, but what kind of treatment is provided? Maybe there should be 2 question marks. Okay, I think this is my last slide because we're still in the early days of this. We really started the work in 2020, and I don't forget, 2020 was a rough year. So things were really slowed down, and our partners, they did a good job of still powering on ahead and getting some interesting results. But now they're more or less wrapped up. We're still waiting for some final reports from some countries, but we're now in the phase of recruiting additional countries, taking this forward, and we're hoping to follow the example of water quality testing in household surveys, which we started working on about 10 years ago now in a couple of countries, and then a couple more countries. And now it's fully gone to scale. It's an off-the-shelf option for not just the UNICEF multiple indicator cluster surveys, but the demographic and health surveys and other national surveys. So over 50 of these surveys have been done now. So we're hoping that if we come back in, 10 years or maybe even 5 years, who knows? Maybe there'll be, examples of this kind of scale up of collecting data on safely managed on-site sanitation. Oh, is there any more? No, that's okay. It's the same idea. There are different types of data sources. I don't even want to show that one. But go to the website to download some of the suggested for and expanded questions. Thank you. The one on the right was one, the supplement, that web page, the sanitation project.
Patricia Damakola is my name. I'll be sharing experiences on how we have practically used and launched rural sanitation and hygiene monitoring system in Uganda. Case studies from the USAID Uganda Sanitation for Health Activity. Just to get us started is for us to know that currently in Uganda, only 19%, about 19% of households have access to basic sanitation. So majority of the households are actually in the unimproved range of basic sanitation, unimproved service for sanitation, which is about 55% of households. Now, the country is working towards ensuring that 40% of households have access to basic sanitation by 2025 in the National Development Plan 3. That's an uphill steep task. So for that to be effective, the country will need to have a solid monitoring and evaluation system that they can use to rigorously track this statistic. A bit of a background of how the national sanitation and hygiene system looks like in Uganda is that collection starts at the grassroots level, which is basically collection by community health workers. They collect data from house to house within a village, and they're supposed to comb the whole village. However, the challenge is most time these community health workers are not well trained and they are not motivated, to do the work because they are volunteers, ideally. This data is then aggregated and sent through what we call a sub-county and parish up to a district, and it's compiled at that stage. The challenge here is that the person at the district is not able to, how sure are you that the data that you have received is correct? So they oftentimes just take whatever they get. They have no way of quality controlling this data, and that's a gap. Like, how will they start? Where will they go? So all this data from the different districts then ends up with the Ministry of Health, Environmental Health Department that compiles this data from Ministry of Water, and then it's shared with UNICEF, World Bank, and other entities. And of course, same challenge at the ministerial level. They are not able to ascertain the quality of the data they are getting. So overall, the community sanitation and household data system in Uganda is largely paper-based. It is very output-based, meaning that there is more, it's geared towards counting presence or absence of a latrine, but there's not much focus on behavior. I'll dive deeper into that as we move. And of course, limited human resource and some skills gaps, as we shall see. So we aligned the Ugandan context to the 5 pillars of the M&E framework that Andy presented. And what we see is that for safely managed services, currently the status quo is that most of the community tools are not yet entirely SDG focused. They are still MDG focused, that is one. Then two, of course, they are geared towards counting latrines of any kind. So we do not yet disaggregate by services, service ladders. Those are the old systems, but the government is moving from that, and I'll show you when we move. In the next slide, of course. Yeah. Open-defecation elimination. What is happening? Currently, our focus is more on presence or absence of a latrine and less on, safe disposal of child and infant excreta. And that is where we should be going. But this doesn't come out clearly in the community sanitation and hygiene tools, at least for Uganda. Then, of course, for hand washing, the gap is that we go just to counting presence of a facility, but not the behavior, the presence of water and soap. That is lacking. Then for equity and inclusion of sanitation and hygiene, the tools focus again more at household level, but don't dive into the marginalization of communities and other disaggregates as may be desired. And of course, for sustainability, how are we going to ensure sustainability if we don't have the ability to track changes in sanitation at household level? Because usually data is cross-sectional, we count and count and count. So how are we determining the trends? So what is happening now is that the Government of Uganda, through Ministry of Health and Environmental Health Department, with funding from UNICEF, is currently developing a national wash management information system that is going to aggregate data from the different ministries of health, water, but also from NGOs like USHA and many others. We have so many NGOs that are doing a good job, but you find that each NGO has an M&E system that is fragmented, it is siloed. So the purpose is, if you're working in the wash space, you should be able to have access to the national wash system and then contribute to the data cause. That is what is being developed currently. So with USHA, we are a 60 months long activity that started in February of 2018, yet to end in July 2023. Working in 20 districts. This is where we work in Uganda, in the northern part, central part, and then the southern part of the country. We work in about 2 to 3 sub-counties per district. That is how wide we go. But we cover a whole village when we go in. Because of these challenges, we had to develop our own wash MIS system that will address some of the challenges I've mentioned. Today, we have over 2 million records of data. We have a system that has over 200 users, and I'll be delving into the system shortly. And we work with these partners over there. So what does our system do? To start off, our M&E system ensures a comprehensive baseline. We baseline at village level, so we map it all 100%. And as we baseline, we go beyond access or presence of the latrine to ascertain the materials of or the parts of this latrine that we are looking at. And the tools are designed in accordance with the GMP, WHO, UNICEF standards. We ask questions on equity and inclusion, gender, age, disability. We also ask socioeconomic parameters such as ownership of a mobile phone, because when you link these data sources together, they enrich the outcome, which is helping communities, increase access to basic sanitation. And we believe that it's not just enough to count this, but we need complementary data sets. So we do intermediate data collection of the processes we do, like we have sanitation promoters who are equivalent of community health workers, the people that visit the households on a day-to-day. So we also track those in separate tools, the masons that are there and trained to construct latrines. We follow those up, the trigger sessions that happen. So each of those systems or processes has a tool, but this tool is integrated into what we call MIS. What we are seeing with the national system is it is growing, and our advocacy is that as we grow, we need a system that integrates with other pieces, because having just one piece is not sufficient from what we see. So as we work, we then align households at a point of where there is improvement in a sanitation facility. Or if there's no improvement in sanitation, then you don't need to go back to that household, but you need a smart system that longitudinally tracks these changes. So once you assess a household once, there's no point of going back if the sanitation doesn't improve or decrease, like there's a catastrophe and maybe a household loses their sanitation status at baseline. So as we do that, we do a lot of learning, we track lots of metrics. Interesting things that we track in our tools are indicators like the number of households that invested in sanitation on their own, percentage of households that change within the service ladder, preferred latrine options for households that are getting sanitation and the like. So our data management system looks like this. This is what we use at USHA. We basically author data collection forms in a simple Excel using ODK scripts, and then we upload them to our server. We subscribe to Honor, which is an open source platform. You only need internet to upload data to the server, but all data collection is offline. So teams don't need internet bundles when they're collecting data. So we then link robust visualization system to this data such that as people are working, they get a loop back of feedback of what they are collecting. And that is one of the gaps we see with the systems. countries should not just assess service ladders. They're nice, they look good, but there is more to the service ladders in analysis platforms, and you need interactive analysis software. So currently we've linked we use Microsoft Power BI to link for analysis. So just to stress the fact that I'll just talk through this dotted blue line, is that after we do our baseline, we then go back to do step 5, which is the end line, and we link longitudinally. So you don't have to collect certain parameters that do not change frequently. You're saving time, you're saving money, but you're being more efficient. And then we track these at rigorous points. So we have kind of what I would call a smart database. And that is what we are advocating for countries to look towards too, as opposed to point collections, and whereby every entry of data will look like a different household because there is no way of uniquely identifying these households. Here is an example of what I'd call a game changer from USHA, whereby one of the biggest gaps we have found was that when we go to the communities to collect data, we do not have a system of feedback back to the community. I mean that household down there that doesn't have a toilet. I mean that local council chairman who is supposed to lure his village to get sanitation. So what we did is after baselining, we generate a map like this. And this map is telling, and we take the map and discuss it with the community, whether they are literate or not, they're able to interpret this. It's beyond the data, it's beyond the paper form, it's beyond this phone gadget that we have. And where you see a black dot, which is this one, apologies if it's not very clear, it means that that household doesn't have a latrine. So the household is able, we print it on big canvas like you've seen people using out there for the side events, for the poster presentations. And we even encourage them to get permanent markers to localize and use the map more, because the shape files we use may not be up to date depending on the country you're in. But this has helped us, and people look at data in a different perspective that they feel. So how are you doing it in your country, in your developing country especially? Because you're not going to discuss Excel spreadsheets with someone who needs to improve their sanitation, are you? I don't think that's efficient. So I've talked about the strength, but just to echo again is we need systems, at least for USHA. We are able to design and change within our system internally because we have in-house capacity is very important. We don't need to hire an expert from anywhere in the world. Everyone, the ML department is trying to do this in-house. The system and collection is real time. Someone is collecting data now, North Carolina, just log on and I'm seeing how data is coming in. So those are the kind of systems we're advocating for. Our system is evidence-based. As we go into every latrine, we are picking GPS, we pick a picture of the latrine. So we have over millions and millions of sanitation pictures. And we are all, in the sessions we had yesterday, we are talking about artificial intelligence and machine learning. Maybe that's the future of just picking pictures and running service ladders, maybe. Longitudinal, I've talked about that. We have inbuilt checks to ensure that some errors are taken care of at data collection and at analysis. Here is an example of how we drill down. Allow me to talk about drill down. You may not be able to see, but what I'm trying to show here is that the system should allow someone in the district to drill down and be able to look for a person, not a village, not a sub-county, but a person. And not today, I am going to do joint supervision. Let me look out for the household of Abu Bakr Kasule, who has no latrine. So we want interactive systems beyond dashboards. They should look nice, but how interactive are they to help us better sanitation? How practical are they? And as I conclude, these are the recommendations from our USHA story. We believe that governments should begin to think of fully transitioning to digitize evidence-based data collection systems. And these tools, we should begin to think of how do we then link follow-up data to baseline data, a bit of longitudinal data tracking, and it can be done in a simple manner. And we need to ensure that these tools can be done in country. We have universities, we have ministry departments. How can this be done to minimize cost, but also ensure sustainability? Then we also, of course, can't forget the issue of training the district local government teams, right from the district to the ground level, thoroughly in data collection and ensuring that the teams will then have access to their data and use it for planning, but most of all, to improve the sanitation status of the community. Thank you very much.
All right, thank you. Perhaps we can take some questions for the three presenters. Anyone? Ricky, please.
Hello.
Hello,
Some people couldn't recognize.
even with a mask.
I know. Two questions. One is for Patricia. Who just spoke, which is a little less formed because it just finished, but wondering if you can speak, like to any recommendations around kind of how to get to the point that, like recommendations around like building the behavior of using the data. My sense from the use of markers on the maps is that you might have some like practical guidance on just kind of building the habit of looking at the data you're collecting. And then for Rick, I was wondering if you could, I was specifically interested in the administrative data and like, where would you draw the line at like, I know a lot of service providers who could say like, we do about this much per month. And sort of like, how would you make use of that?
Thank you. Please.
I have a question for Patricia. With regards to government engagement and next steps to adapting the system to meet the national system, where are you going with it? What are you planning on doing to engage the national industry?
Could you also say your name, please?
Oh, sorry, Brian, individual consultant at Data.
Cool, fantastic. And maybe we'll take one more. Matt?
Rebecca Evans from Warwick University. I'm maybe slightly different discipline, but I just wanted to ask you particularly about who owns the data and yes, things like privacy and ethics and things.
Great. Fantastic. You want to go first?
Yes, thank you. The first question was on behavior of data use. So in USHA, we are a results-based activity like most GSA projects. So we started off without data, just as a government, and we struggled. And then we realized that how are you going to show evidence that you're creating change? But for you to do that, you need to be purposive. So we started by making our, I'll give you like what we do in our office, like a Monday morning meeting is not blah, blah, blah. It will be data driven, and data driven is live data. So we log into the database that everyone is able to access and begin to discuss data, the gaps, the gains, and everything, and make recommendations. So because we do that, everyone begins to appreciate the impact of data. So when you collect the data, you have to use it. Use it with the people that are collecting it. Use it with the people that you're getting it from. When we go to the communities to, discuss about improving sanitation, it's not just blah, blah, blah. We discuss with data and we say, when I went out with you to the field, remember that day we picked this. So it is more purposive. It's not fictitious, it is real. And I think there's a way as human beings have that DNA, when something is real with evidence, we then own it and then use it. So that's how we have managed entirely. How we engaging the national system. So we have shared our system. We have had lots of discussions. We sit on the committee that is vetting the national system. We recently had the second stakeholder engagement meeting, and they are using USHA data, our data, as pilot data into the system as government is building. So we've advocated. Of course, we don't expect them to do everything because it's big. I mean, it's a country data set. but at least the best practices or the minimum is what we have advocated for. But we have also encouraged local governments. We have a local government called Zimbabwe that has since appreciated what a data-driven intervention program does. And they have committed their own resources. And we have set them up as a district local government on this system. And then we have many coming up. So I think it is first of all showing that it's work, you demonstrate that it works, and then people begin to come on board. But we are not tiring, we are part of the board, we are advocating, and they know, like, we keep sharing experiences, what works, what doesn't work. They may not take everything. And also we've been keen to tell the government that even when we get this MIS system, it's not going to be sufficient for all the data needs. It can never be. There will still be need for a parallel monitoring and evaluation system. So what's going to happen? We need to think. Probably CSOs like Usha can help, set up cheap systems that are efficient. So how do we support that? Who owns the data? So the data is for, well, I don't know what, if like us as Usha, we share this data with the district local governments because they have access to that system. And as we are leaving, we are handing over all the data to them. Like I mentioned, we are given this data to the local government, to the country to have in the national database. And also being that sanitation is a national good. So we know that, and we would like to share as much as we can with the country where there's no duplication of resources, where we can save money. Why not? If we've already done the work, let the country take the resources to other districts that don't have data, and then they start there because we have something where we've been working. Thanks.
There's still an ethics question in there, but Rick?
So on this question of like, how much evidence based, what's the inclusion criteria for taking data from national sources? So a first principle is it can't just be based on estimates. Like you can make a nice shit flow diagram from, we think about this much, and that's really useful. But for SDG reporting, it's got to be based on some data. Now there are data limitations, so sometimes it's a little bit fuzzy about how precise those estimates are. But basically, we defer to the national authorities in all cases. So, and there's a hierarchy within national authorities. So at the very top of the hierarchy is the National Statistics Office. I saw you had UBOS listed on the slides in Uganda. Basically, if UBOS would say, use this data, we'd say, we will use that data. Often there are tensions between the Statistics Office and the sector ministries where they don't trust each other. And we've had cases where the Statistics Office does not endorse a sector report. And if there's a conflict, we would defer to the Statistics Office. And then next in the hierarchy would be, I would say, an independent regulator, because ideally there's some oversight and quality control. If we're really just taking something straight from the service provider, there's potential for less reliable data. But for all of our estimates, we circulate the draft estimates for a country consultation before finalizing them and try to have a broad review, including by the Statistics Office.
Thank you. We were originally planning to have a group work, but I think we'll continue with planners.
Yeah, no, I was just gonna put the slide up for questions. Okay. I'm sure, so as Mike said, we were going to do some group work, but I think we've only got 15 minutes before we then have to move into the sort of wrap up bit. So the suggestion was we try and do this in plenary, which I'd still like you to do. But the questions we were going to ask in the groups were these, basically wanting to get some feedback from you on sort of positive thoughts. How best can we develop more comprehensive and progressive national systems? Do you have experiences, cases of, things that have been done to make things work, to introduce new indicators, to improve national systems that might be useful lessons for other people? The second one, we didn't want to start with this because we know that we could spend all day talking about barriers and challenges and not actually get anywhere very useful, but I'm sure, there are some key barriers and challenges that we need to address. So, if there's barriers and challenges that you really think we're not managing to crack, to talk about those. So, and we were saying, okay, some of these may be short-term things, what needs to happen, what can happen sort of quickly, immediately, what are things that are going to take time to sort out and develop.
And
And
if there's no immediate kind of hands, I mean, I'd encourage, there we go.
Well, this is a response to the following question. I guess I wonder to what extent are governments and others willing to go back to a random 5% of communities or households a few months later and see if the reported number of latrines is doubled in, 60 days or something like that. And then sort of a subpoint off of that, to what extent is it willing to disaggregate data sets and say, well, this government's actually pretty good at counting, but the information about where children's species go appear to be useless. So maybe we can sum this with them all.
Did everybody get that? So it's basically using like a sample to verify some of the results.
Yeah, I wonder to what extent.
Are governments willing to do something like that?
Yeah.
I think that's you, right?
Yeah.
No, I don't think it is, because these MIS systems, I think, are really interesting, and we honestly don't have many examples of those. And these questions of sampling or censuses. I mean, I look at the census in Uganda and I think, wow, that's really expensive. And would a random survey have gotten something that also could have worked as well? But you thought about this, and the decision was no. We need the full data. But maybe you would be well placed to say, about follow up on random samples and how reliable that's considered by the stakeholders.
I think if we're looking at prevalence, say, of basic sanitation, a status, a sample would do. But the country is supposed to move households to own sanitation. You can't use a sample because each household has to have a latrine. So you cannot just project on, a sample. You need to reach out and see what is happening from a more localized area.
Can I just add to that? So an example that I could give is from the payment by results programs. And so the SND SSH4A program had worked in 9 countries supported by DFID. And what happened there is they were working with the district government. So they had routine monitoring systems that were supposed to track progress, but they also did through the project 6 monthly household surveys. And basically what they did is compared the results from those two. So looked at the government routine monitoring system, looked at what the household survey said, and in some countries there was a huge gap, and in other countries they were quite close together, and they're like, actually, the routine monitoring seems to be working well, we're finding the same things. And then that led to SNB actually held a sort of data review meeting after they've done the surveys to say, what have we learned from this? Do you agree with it? Do you not agree with it? One of the stories I always give is from Ethiopia, where the first 3 surveys, the government, it was covered a whole zone, 6 waredas, and the government said, no, your survey is wrong. Clearly, our data is good, your survey is wrong. So they said, okay, go and look at the places where they disagree. So they went down to the villages, they went, oh, it turns out your survey was right. And our data, okay, next survey, exactly the same. No, your data is wrong. And finally, by the 3rd survey, they went, okay, we know, we'll go to the villages and sort it out. So they finally said, we get that your survey is telling us something that our routine system isn't, but all the time they were trying to move theirs closer. So but that was funded by a project. And so I haven't seen a government that is actually doing that themselves.
Yeah, that's what I was asking about. If you go back and check every 10th one or every 20th one and you see, oh, we said Abu Bakr had a latrine last month, but this month he doesn't. Does that tell you something about the quality through there?
It does, but who's going to pay for that? That's
Please.
Thank you, everyone. Very interesting. And my point of reference is not from this domain necessarily, more for on the ground surveying and, have you felt with your local stakeholders or the chiefs or those that are actually coming up enthusiasm that there's almost a sense of gamification or a sense that, they want to see their progress over time? Whether or not be real time or if this is a multi-round engagement. Because I know in like a PFR paper results, it's more about the financial incentives, if you will, or there are other, obviously, that's not the only driver, but for on a local level, just to see the improvement where you get it. Have you seen that? Is that applicable for a longer term engagement? Because I would think even in this domain, that would be kind of overstep a barrier to having your kind of that local buy-in. Well,
Perhaps let's take a couple more. Raymond. You can start and then.
I missed the machine learning session. Did they talk about like an analogy to the PPI, progress out of poverty? So, okay, I just didn't want to say something. Yeah, so one interesting way I think to address Rick's point of sort of balancing depth and breadth would be a nice analogy is the progress out of poverty. Actually, it's called the poverty probability index, where they get into these like really intense surveys on income and consumption assets. And then they do a machine learning thing to pluck out like 10 or 12 kind of objective indicators. And so you might, if there's a situation where you need to sort of balance detail and breadth, you might look to that as an analogy. A second question is if there's any desire or interest in kind of integrating with like environmental sampling to see like what the pathways are and how, are these systems effectively like blocking transmission? You've got all the money, so. But anyway, just curious if that.
I know, I think
contemplated or-
there's not necessarily an answer to these, but I think these are great kind of thinking questions.
Yeah, thanks. My name is Valentin. I had 3 questions and I'm coming back to, let's say, government data. We work on it in India, so I think you know where I'm heading to. So we have the government declaring the country open defecation free. And that's basically what's being worked on. And it means also the whole focus of the corporates working on CSR is also changing away from sanitation to something else. But it's open defecation free. And data from the field tells you a completely different story. So that's from how are you dealing, let's say, from the WHO and UNICEF, the JMP. It's a difficult thing. I had for you, Rick, I think there was sorry to say, it was a mistake in your possibly. So, yeah, and then the third one is, I don't know, maybe this to the audience. And we just started, maybe there's more experience in it. First we started with satellite data and then zooming in, and then machine learning and tools. That didn't work very well. So we got ourselves some second-hand drones. Flying now over somewhere in Uganda, got permission, and then linking the drone data to machine learning. Is there any experience? We're just trying. I don't know. Is there something in the audience, someone in the audience who's done it?
Not directly, but there is a lot of machine learning population maps that are generated from aerial imagery and satellite imagery. Is that what are you trying to get at?
The machines have to recognize the toilets. That's a type of toilets, but it's a VFD, it's just etc. So it's a little challenging.
Can we first? Okay, please.
Yeah, you can recognize not just population, but the developmental data. So how developed a certain cluster might be. And then you can kind of make inferences on that into the hygiene. Again, not speaking from this space, but from other applications.
And Yusuf, I just wanted to mention and bring everyone's attention to the experience in Zimbabwe. I did a learning note on this, but it's a rural water information management system. Set up by government. It's about 70% coverage. And what it does is it uses community sort of volunteers or custodians of the water point. They also use for sanitation as well. And they'll just send out text messages once every 6 months with a series of questions, yes, no, that get uploaded to the national system. It is they calling it a real-time monitoring system. So in terms of long-term actions, that is something that is you could aspire to. The only challenge there is the cost of the SMSs, which run into the tens of thousands every month. But if it was a national national telecom company, you know, there is a possibility to integrate the national monitoring system through the national telco. But the other short-term action is, as a result of that, as an advocacy win, they've got they put in TVs into every senior minister government office with real-time data on the level of functionality of water point systems, which is a huge advocacy there. So short-term action there is a few TVs, and that data is so powerful.
And you may change the.
I'm Cindy. So I actually was the consultant for this month in Indonesia. And just to mention, like, answering number one, how they're trying to integrate smart monitoring to the national water quality monitoring system. And I think answering your question that we can try to analyze the data on environmental pathway. So you can relate water quality to on-site sanitation data and see like they would also ask the distance between water supply and on-site sanitation, measure distance between septic tanks and wells. So I think that's also an interesting way to integrate on-site sanitation. And I guess a more comprehensive question, more data is better, but like seeing climate impacts on on-site sanitation, we've mentioned like some are asking what they do during flooding with their septic tanks, but like more also we've done some work with funded by UNICEF on climate resilient sanitation, and we see how much people are slipping back to open defecation, flooding and drought. So I think that's also something to consider.
Yeah. Trisha, do you want to answer some of the questions that were?
It was just one on how do we share data with the village or maybe local chiefs over time. So what happens when like sanitation and hygiene trends improve? What happens? So of course we collect the data, and once there is an improvement, the communities have always asked for a map, another map, but we are not able to do it, but they would love that. So we encourage them to manually, in whatever way they can, use maybe a different color of their map to show that improvements as they happen in this village. Then the other thing we do is, I know the governments have a small budget on sanitation and hygiene that goes to the districts every quarter. It's very little money. So depending on how a village has done, they can be rewarded in a very small way with that small budget that goes to the district, but that is under the district to determine. So there are many innovative ways we can do it. We can't dictate, but we don't have the resources to keep sharing maps, but a verbal sharing that is done whenever there is improvement. We let them know the improvements that are happening. Yeah.
And does that influence their enthusiasm for participating?
Absolutely. That's why I talked of reward systems and I think every village would love their people to be doing better in sanitation and hygiene. And that's we have capacity programs like institutional triggering, where you take them through why, and they always desire to be better. So there are many innovative ways that are proven from programs that we can incorporate. Yeah.
Let me go back to Ricky and.
I feel like this might be a question for you. I mean, I'm not sure. I'd like to hear from everybody. I feel like the core attention that we're coming into is like M&E for what you're describing, right? Like you only need a sample, but you don't need to know that every house has been checked. And the second that we start reporting on level of coverage, there's a lot of desire for the detailed, like every single household. We found this admittedly in an urban context, but like actually when we've done sampling, it just doesn't help us do our job. We need to know what's behind every door. And I feel like this, we see it in our own work also, that like the second we start talking about M&E for kind of checking on where things are, looking for indicators, we are like seduced by the idea of like, oh, but we could know everything. And I feel like ultimately when we think about like my thought on the first question is like, well, the best way to do that is to like give like real practical guidance on like how to manage that tension and how to say like, this is what this is and it isn't that. Or I guess I'm curious what from see them as like sort of representatives of the ends of the spectrum of like, you need all of houses and you don't. And I wonder if from your perspective, you have any thoughts on like whether that's attention, why, and like a practical way of.
Yeah, so two answers left, so Rick, answer.
Yeah, because this relates to the India question too.
Yeah.
So basically, we defer to statistical offices and the sources of data that they have over sector data sources for two reasons. One, there's not a conflict of interest where the service provider is also telling you what the story is. But two, because the inventory databases describe access or coverage or maybe theoretical coverage, which is very different from actual use. And a household survey or a census is just a better way to get, it's still flawed. I mean, you pointed out some of the problems with household surveys, but at least people are reporting use of systems, not some theoretical access to systems. So in India, we don't use the Swachh Bharat's database that showed how many latrines were built. We use the household surveys and the censuses, which continue to show, significant open defecation in rural India in particular. And it doesn't really matter if the government has declared India open defecation free. We'll still rely on those household surveys. And just so I think there are different needs where in some cases you need an inventory, but I think recognizing that inventory is better suited to be about coverage or maybe theoretical usage. And that complements data on actual reported usage. Another limitation of inventories is often they're very blind, not always, but often they're blind to private facilities, whether it's water or sanitation. And I mean, there's a role for inventories of public supplies, but it's okay for that not to tell you the same exact story that you get from a random sample of household surveys.
Thanks, Rick. Andy?
And then, okay, yeah,
perhaps-
we're kind of very much out of time, so try a very good. I think my take on it is that I agree that we need household by household data, particularly when we're looking at kind of collective outcomes, wanting to achieve area-wide outcomes. We have to know what every household is doing. So at some point we need that data, but we know that in most national systems, I won't say all, but most of the ones I've worked with have reliability problems just because you've got thousands of people in thousands of places. Some of them are not doing a good job. So my experience is that you have to have some way of checking on that data. You have to have some systematic way of spotting data that is not correct. So I think you need some other form of system that then looks at that. If for nothing else, that what I found through all the payment for results, payment by results, all that stuff, when you know someone's looking over your shoulder, it does change behavior. And so when they know someone's going to come and take a sample and look at stuff, it influences the reliability of the data. So it's not perfect, but I think the process I described earlier of trying to gradually move people towards, and where you have a clear measure of how far off your system is, then you kind of know what you've got to sort out, and I think that makes a big difference to how you can use that data. We were going to try and close up, but we'd given Patricia the very difficult problem. It was going to be to summarize what came out of the group work. How do you feel about trying to summarize what has come out of those questions in 4 minutes? Well, she's very talented and brave.
Yeah, so one is we need to rethink the rural sanitation and hygiene systems. They need to be practical. They need to be able to help a district local government cadres down there to first of all understand the status of sanitation and hygiene at village level before you reach the district. And then this same system should help this DLG staff be able to design appropriate interventions, because a household that is OD will need a different intervention from a household that is unimproved, on the unimproved service ladder scale. So there is no one size fits it all. We need data, and the districts should know that it's their data. They should be able to drill down to households and give appropriate interventions. Otherwise, we shall be talking about the 2030 targets, and it's just a wave. But if we are passive and then we use data, then we should be getting there. Then secondly is, it's evident that we need to move from paper-based to digital systems of sorts. And also knowing that even if UNICEF is funding most of these systems, that same system that is going to come is not going to solve. They need to know they are not going to solve all the sanitation and hygiene questions that a district or country has. So they may still need support from CSOs and other NGOs, and they should be open-minded. Otherwise, if they put all the eggs in one basket into the system that is coming, there will be a problem at one stage. Thank you.
Okay, okay, I was supposed to ask Patricia Rickenmeier if you had any reflections you wanted to add after what would have been the group work.
I think Patricia summed it up nicely, and I don't want to follow that.
I think my one thing speaks from the last bit that Patricia was saying, and partly the reason why we wanted to put, this guidance together in the first place. At the end of the day, we can't be coming together and saying different things when we're talking to the government, right? It's important that, we have our support. We're hoping that what we did at global level can help guide our country counterparts, right? To kind of say, okay, if our people here on top are agreeing, at least we should be able to kind of agree here on the ground. And hopefully, when you guys want to do a research or you want to do this, make sure that you check there's already something out there, right? That's probably been agreed, and perhaps align to it as much as you can. If there's new things that you'd like to add, that's perfect. But at least support what the national government is endorsing.
Very good. Thank you, Mike. Thank you, Patricia. Thank you, Rick. The last couple of things from the Sanitation Learning Hub. So, what they're looking forward to, what the next steps are. So there's kind of two areas there, looking for help really, or looking to collaborate, looking to see if anyone's interested. So the first is anyone who just wants to sort of use these materials, this guidance, to work with government counterparts, to review their own frameworks, to look at new indicators and approaches. They're very keen to work together on some of this stuff and see if they can sort of help capture learning and share that within the sector. The second one is more sort of practical, saying, if you have any indicators, approaches, guidelines, examples that you think are missing from all of this that would add to it, then we're very keen to hear from you, share those things with us, and we can add them and enrich what we have. So thank you very much for your time and your interest, and I'm hoping we get at least one person to sign up on my list. Thank you.
Yes, we are trying to make it person, yeah. Well, it's here for tomorrow, but it's interviewed for a while, it's my responsibilities, and now with Rodney moving on. Taking on the retirement group, we're kind of taking over a little bit of, outcome and I go for a few other grants. Tomorrow we I'm not sure. Yeah. I got to say different things. They're not there.
Yeah.
Considering it as fire. Yeah, should be good. Waiting for you. Yeah. You guys.
But, like,
Right, right. By stakeholders for many years. Really don't actually.
We can just review that.
Right. You want to, another, like, you know, like, silent ideas.
But even if it's nice, yeah, research. Yeah, that's about, yeah.
And these foundations like really like education. Yeah. There's definitely the water part as well. Being a good lead on that and
Or even kind of like
well, so I kind of feel like something that's building there, but we're likely to do a lot of invest in building out kind of extending sanitation, but realizing the value in the entire context. That's yeah, no. It's like worse than all the times that we for it's telling me about the indicators for all of it. So it's like, learning about